Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Percutaneous kidney biopsy. Pediatrics. Introduction. This program explains percutaneous kidney biopsy. Percutaneous means that a needle is used to take the tissue sample. The program discusses the risks and complications of this procedure. The kidneys. Kidneys are bean-shaped organs located in the middle to lower back on both sides of the spine. The main function of the kidneys is to filter harmful chemicals known as toxins from the blood and to get rid of excess fluid. Most people are born with 2 kidneys. The kidneys make urine, which then flows through tubes called ureters to be stored in the bladder. The kidneys control the amount of fluid we keep in our bodies. For example, when we drink more fluid than we need, the kidneys make extra urine. When we drink less fluid than we need, the kidneys make less urine. Reasons for kidney biopsy. Kidney biopsy is done to diagnose kidney problems. In a kidney biopsy, a healthcare provider takes a small sample of kidney tissue for testing. The results of the biopsy can help your child's healthcare provider figure out what is causing your child's symptoms. Kidney biopsy may be the next step after blood, urine, or radiological tests. It can help your child's healthcare provider figure out why blood or protein may appear in the urine. It can also help him or her determine why your child's kidneys may not be properly filtering waste products from the blood.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Before the procedure. Before the biopsy, your child's healthcare provider may take blood and urine samples. This helps ensure that your child doesn't have an infection or other problems. Radiological tests such as CAT scan, MRI, or ultrasound may also be done before a biopsy. Before the procedure, you should mention all the medications and supplements your child takes to his or her healthcare provider. Some medications and supplements can make the procedure riskier. Ask whether your child should continue taking them before the procedure or if you need to follow special instructions. If your child snores or has breathing problems, let the kidney doctor know. Also let them know if your child has any allergies or has had reactions to anesthesia in the past. If your child is sick, the procedure may need to be rescheduled. If your child is not feeling well or has a fever, stuffy nose, or cough, call your child's kidney doctor to let them know. Your child may not be able to eat or drink anything before the biopsy. This lowers the risk of vomiting during the procedure. Vomit may go into the airway during the procedure and cause breathing problems. Check with your child's healthcare provider to find out when your child needs to stop eating and drinking. Procedure. Kidney biopsy takes on average about an hour. Usually for the biopsy, your child will lie on his or her stomach or side. Your child may go home a few hours after the procedure. He or she may stay in the hospital overnight. This procedure is usually done under deep sedation. This means your child will be asleep and will not feel pain. The area where the needle is inserted will be numbed. A healthcare provider may use an ultrasound to find the biopsy location. The provider may then mark the needle insertion location on your child's skin before numbing the area with a local anesthetic. A small incision may be made, and a special needle will be inserted into the kidney. This needle is used to get a sample of your child's kidney tissue. The needle may be inserted multiple times to get a good tissue sample. After the biopsy, your child's incision will be covered with a bandage. A healthcare provider will monitor your child's vital signs and level of pain. Percutaneous kidney biopsy may be too risky for children with a blood clotting disorder or only one kidney. In these cases, your child may need an open or laparoscopic surgery to get a tissue sample. In an open operation, tissue is removed through a large incision. In a laparoscopic procedure, the surgeon will insert small instruments into your child's body through multiple small incisions to take a tissue sample. Risks and complications. Percutaneous kidney biopsy is a very safe procedure. Risks and complications are unlikely, but they are possible. Knowing about them may help you and your child detect them early if they happen. The risks and complications include those related to sedation and those related to any type of procedure. Sedation is safe, but like any medicine, it can have risks. Risks of deep sedation may include feeling restless, headache, itchy skin or watery eyes, nausea or vomiting, pain, sore throat. Your child may have temporary short-term memory loss or trouble concentrating. He or she may feel tired, weak, or unsteady. These symptoms should go away within 24 hours. Your child may fall into a deep sleep during the procedure. Medicine may be needed to wake your child up. Your child's breathing may become irregular or stop. A ventilator may be needed to help your child breathe. Your healthcare provider will discuss these risks with you and ask if your child is allergic to certain medications. Allergy to the numbing medication is a risk. You should let your child's healthcare provider know about your child's known allergies, especially allergies to numbing medications. These allergies are rare, but they could be dangerous. Other risks are possible in any procedure. These include bleeding and infection. Bleeding is unlikely, but if it does happen, your child may need a blood transfusion and possibly an operation. Infections are rare, but if they happen, your child may need antibiotics and possibly surgery. Other risks are specific to this procedure. These include damage to internal organs and blood vessels. If an injury like this happens, your child may need an operation. In extremely rare cases, injuries to organs could be fatal. High blood pressure can happen due to a collection of blood in the kidney, but this is very rare.
If you like this video, please like and share. For similar videos, subscribe to our channel.
After the procedure. You will need to take your child home from the hospital after the procedure. Your child may have to go directly home and remain in bed on his or her back for about 4 to 6 hours, depending on the instructions of your child's healthcare provider. Your child should rest a lot for the first 3 days after the procedure. This will help the incision and kidney heal. Your child should avoid extra physical activity for the first 4 weeks after the procedure. This includes activities such as gymnastics, rough play, horseback riding, physical education (PE) classes, and contact sports. Also avoid amusement park rides and activities that put pressure on the back. You can expect your child to feel a little soreness at the incision site and possibly some pain after the procedure. These feelings are normal. Your child's healthcare provider will tell you what medication your child can take for them. Do not give your child aspirin or ibuprofen for the first week after the procedure. These make it harder for your child's blood to clot, which is very important for healing. Your child may pass pink, cloudy, or bright red urine for the first 24 hours. Tell your child's healthcare provider if your child has cloudy, bright red, or brown urine. Seek medical advice if your child cannot urinate, feels burning while urinating, feels like he or she must urinate right away, urgency, has to go to the bathroom very often. Seek medical advice if your child feels weak, dizzy, or faint, has a fever and chills, has worsening pain, develops any other new symptoms,
Thank you for using Explain.